Here we are. Hello, everyone. Dr. Nushin Darvish here at Holistic Naturopathic Medical Center, and we are going to be talking about something that is super, super important today, especially during these times, and that's anxiety and depression, which have skyrocketed since COVID-19 pandemic and shutdowns and close downs begun. So we want to talk about how are we going to address this from an individual and a group perspective? What are the things that we can look at root cause wise? And what are the things we can do to help each other transform? So I'm going to have Dr. Marian join me right now. And then we're trying to get her onto Instagram Live as well. Now, and then we're trying to get her onto Instagram Live as well.
Hello.
How are you? Good to see you.
Good. How are you?
Good.
Let's see if I can maybe make these a little bit more similar, so I'm not looking in two places.
Well, we're talking about depression and anxiety. I was just looking at statistics just before all of our little Q&A this morning or this afternoon, and it's astonishing that before COVID hit, 1 in 4 Americans have been suffering from depression. 1 in 4. That's 25% of the population here, of the adult population, and that majority of the depression and anxiety starts anywhere between age 15 and 24. And those are really the prime years, right? When the hormones are shifting, when we're trying to figure out our autonomy and our identity as individuals. And that's when all of this is hitting. And on top of that, the suicide rate amongst these youth is astonishingly high. So 1 in 6 US youth experience some kind of mental disorder, and then 1 in 4 adults. And I believe that has even gone up higher now, with something like 80% increase I've seen on some of the statistics out there with increase of depression and anxiety. And the unfortunate thing is that many people are just being told to pop a pill, an antidepressant and an anti-anxiety pill to overcome their depression and anxiety. And we're about something different, right?
Yeah, yes, we are.
So we really want to look at the root causes. Yes, we really want to look at the root causes of depression and anxiety. And I think this is a huge, huge topic. What I also learned was there's 10 million Americans that have suicidal thoughts annually. And we in the US have one of the highest rates of depression and suicide and anxiety compared to at least the 11 other economically elevated countries in the world. So we're up there with suffering a lot with depression and anxiety. And I think we really need to discuss why that may be, or at least our ideas of what that might be due to. Now, the reason this is also really important to discuss is because long-term, it does increase our risk for anxiety, for metabolic disease and diabetes, right? And stroke and heart attacks. I did a post a few weeks ago about checking in with your heart, right? In Chinese medicine, the heart is not just the physical heart, it's also the emotional heart. And so when we are depressed, when we are carrying baggages, when we are sad and anxious, it physically affects our hearts. And so again, this is one of the reasons we want to address these mental health conditions to help our physical being as well.
Yes, absolutely. Depression definitely changes eating behavior, and that can lead to carbohydrate craving and sugar craving, and therefore diabetes risk. as well as craving high fat foods. If dopamine is lower, so all of those things are important.
Yes, yes. So let's talk about some of the symptoms of depression, because some people may not recognize they're actually depressed.
Mm-hmm.
So
yeah. So sometimes we'll see low energy and fatigue being really the main symptom of depression. And that might mean less motivation to get up off the couch and go for a run, or less ability to focus on one's work or homework, or so either mental or physical energy. Other times it's just a low mood, feeling less well about one's life. And what else would you say, Dr. Darvish?
well, changes in libido,
Mm-hmm.
feeling tired, irritable. Oftentimes, we see men get angry frequently when they're depressed,
Mm-hmm.
and we don't recognize that it's actually depression that's causing the anger. With women, their hormonal mood swings may be elevated, confusion, memory issues, feeling low and having trouble with sleep,
Mm-hmm.
maybe something else, concentration issues. So the list can go on with depressive type of symptoms that may be a sign of anxiety or depression or some biochemical change or some toxicity. And I think this is where we are really good at homing in with people when they're feeling depressed or anxious, is where is it coming from? And of course, right now, the COVID-19 shutdowns have promoted a lot of isolation. It is very difficult for a lot of elderly who are alone. It's difficult for family members. There's a lot of separated families in different countries that are having a lot of trouble with anxiety and depression because of the situation they're in. But I think there's a lot that we can do to support ourselves in the process, elevate ourselves so that we can be much more productive in our relationships and our work and in our physical well-being. So, a couple of questions I have for you, Doc. Where do you start when somebody comes in with depression or anxiety?
Yeah, so first we ask questions about that label. Was that something that they were given to by another doctor? Was that something that they themselves decided that they're experiencing? One of the big things that naturopathic doctors are doing is seeking to address the cause and find the cause. And so that means asking a lot of questions about how someone's feeling and exactly how they are experiencing this quote unquote depression. And so that's where we might start. And then we are often looking deeper as far as whether that might be contributed by the thyroid or the HPA axis, as Dr. Darvish mentioned, which is the hypothalamic, pituitary, and adrenal axis, basically the communication between your brain and your adrenals, which helps you to respond to stress and helps you stay energetic, and can become imbalanced with chronic infections or chronic stress, such as COVID and other situations that are going on in the world. We might ask about sleep, we might ask about diet, we might ask about family structure and interpersonal relationships. We spend a lot of time asking a lot of questions because we really want to get down to the root cause of what the person's experiencing, because then we know we can change that and achieve more of a curative treatment versus a pill, which is just suppressing the symptom. And sometimes pills are necessary, but if we can get to that root cause, maybe it's only a temporary tool and something that we can wean off later on.
Exactly. I like to look at the root causes as either falling into the category of physical, mental, emotional, spiritual, or a combination of some of those, right? So let's talk about the physical root causes. What are some of the physical root causes that we often see with people suffering from depression and anxiety?
Yeah, so I would say one of the biggest ones, especially in Washington State, is a vitamin D deficiency.
Mm-hmm.
And that's really huge and can affect your immune system, your energy level, and definitely your mood. Diet issues can also play a role. Actually, a high protein, low carbohydrate diet is actually associated with depression, as well as the standard American diet, because there aren't enough vitamins and minerals in the standard American diet. We can also think about go ahead.
I was going to say, just to add to that, is food allergies, right?
Mm-hmm,
because one of the most common foods that causes depression is wheat. And oftentimes people crave the wheat, the bread, the pastas, and they eat it. And then half an hour, 2 hours, 3 hours later, they get this depressive mood. And if they're doing it every day, then you're constantly going to be depressed. So getting off of the wheat or the gluten will help with your body not being so burdened by the allergic reaction to the wheat, and help elevate your mood more.
Yeah, there's actually an interesting opioid response to food sensitivity. So when you eat something that you are either sensitive or mildly allergic to, your body actually produces opioids in the same type of chemical that morphine or heroin is. And so you actually become addicted to the very foods that are the most problematic and most inflammatory for you. So if that's gluten or dairy or eggs or nuts or whatever that may be, you might find yourself actually craving those foods because you are producing opiates in response to those foods. And so they're often the hardest to kick because you actually form a habit around the foods that are most problematic for you.
You know, that's a really good point. And the other thing that I actually see very commonly right now during this shutdown is alcohol.
Yes.
And I would probably say 8 out of 10 patients of mine that come in here have something going on with the liver, and it's a reaction to too much wine or too much alcohol. Even if they're just doing a glass of wine, but they're doing it every night or every other night, it's taxing their liver, and they're having a reaction to that. It's making them very, very depressed, and they don't realize it. And so the next night they say, hey, you know what, let's have another glass of wine because I'm feeling too stressed or too low. The wine will chill me a little bit. So I think it's really important for all of us to realize that we may crave a food, just like you said, because it elevates some of these or changes some of these chemicals in our brain, and it makes us feel good for that period of time. But then a few hours later, it actually causes a low in our nervous system. And then we get more depression going, right?
Absolutely.
So what else, Doc, on the physical level do you look at?
So the microbiome often plays a role. We did a whole talk just a few weeks, maybe a couple of months ago, about the interaction between the gastrointestinal system and mental health. So maybe we'll just mention that briefly here, but an imbalance between what we would consider good to bad bacteria can create a lot of inflammation and decrease your ability to make serotonin and other feel-good neurotransmitters. And so oftentimes we need to address the microbiome and make sure that we are either clearing out bad bacteria, parasites, funguses, candida included especially, and then replacing with good healthy bacteria and good clean diet to help promote healthy bacteria can be a really big important piece.
And the microbiome also gets damaged or dysfunctional or imbalanced because of food reactions as well, when we just talked about, right? And then also mental stress, like you were mentioning, that and the HPA axis, the adrenal axis, will affect the microbiome. So if you are interested in learning more about the microbiome and the gut and the mental health, one of the first webinars and Instagram lives we did talks more deeply about that. So please do look that up on either drdarvish.com or Holistic Health. So microbiome, we've got food, we've got alcohol, and along with that, how about medications and other chemical exposures, right? So your cleaning products and the toxins.
Pesticides.
Exactly, right? All of that will disturb and cause more toxicity in the system. So really, we're talking about toxins causing more of a reaction in terms of mood changes and depression and anxiety. And then we've got metals. What do you have to say about metals, Doc? Because that's an important one.
So my favorite metal to talk about, my least favorite metal probably of the world, is mercury. And we've mentioned this a few times in previous talks, but the silver fillings that a lot of the older generations, including myself, had in their mouth definitely contain about 70% mercury. And being so close to the brain, the mouth carries a lot of toxins up to the brain and can really cause severe depression. I've seen a lot of patients with severe mental health issues, both anxiety and depression, up to including very serious suicidality behavior, and have their symptoms be completely, almost nearly resolved with detoxing mercury. And these are patients that have tried everything under the sun. They tried medications, they tried meditation, they tried counseling, they tried diet changes, they tried yoga, like literally everything under the sun. And they're at their wits' end, and again, suicidal. It's really quite sad. And you take out the mercury and you detox the mercury from the brain, and it's resolved. And they put 10, 15, sometimes 20 years towards trying to fight that battle. And really, it was just a heavy metal toxicity issue. So
yeah, I agree with you. I agree with you. And there's different ways of addressing the heavy metals. By the way, somebody is asking about cleaning products causing symptoms of anxiety and depression. And I would say yes, for some people that is a big issue. And so we need to make sure that you use very, very clean products. Where is the mercury found? Oftentimes it can be found in every tissue. The problem with mercury is a few. One is that it has an affinity for the fat cells. So our brain is a lot of fat. And so it will go to the fat cells in the brain. It will go to the nerves, which have a lot of fat. And so you're harboring this. And if you're obese, then you're also harboring it in your fat tissue in your body. And so when we're detoxing these or chelation means that we're basically using something, whether it's your body's own mechanism or some other agent, to bind these heavy metals and pull them out of your system. We need to be very, very careful, especially when people are fighting neurological diseases, along with the depression, or they're obese, because when you're losing weight, when you're burning that fat, you're going to be releasing a lot of those toxins, those chemicals, those metals, and that will cause more toxicity in your system until we are able to get it out. And that can actually make sometimes the depression worse.
Can you see me on Instagram? Your screen is frozen, but I don't know if mine is.
I'm not sure whether I shut out from Instagram or not, but my connection is really weak on Instagram, and I think it's reconnecting.
Oh, there we go.
Okay, yeah. Okay, so the metals are very, very important.
And what about just in case Jen's question was about where mercury is found as far as where we might be getting it. The teeth are just one source, but it's also really prevalent in the ocean. And so large fish like tuna and halibut and swordfish, those kinds of things carry a lot of mercury. And so eating those on a regular basis can be a big exposure. And those are kind of the two big ones that we think about, but really there's probably a few more that we should think about as well.
Well, then there is also aluminum and lead. And nowadays, aluminum is becoming a bigger issue than mercury because of all the aluminum packaging, all the chips and crackers and bars, and Teflon or non-stick pans, aluminum-based deodorants.
Right.
There's a lot of aluminum that we are getting exposed to that is also causing some of this depression. So if you suspect that you may have metal toxicity, I would highly recommend that you seek out a physician to evaluate you for this and institute an appropriate treatment plan. And this is one of our things that we do here, one of the specialties that we do here. I guess they're not hearing me. Are you guys hearing me again? Please give me a wave or a thumbs up or something if you're hearing me now on Instagram. Okay, great. Thank you. So, so metals need to be looked at. By the way,
they said can't.
We can't hear you.
Can't hear.
Sound issues. It must be a connection issue. I'm not sure what to do with that. Can you hear me now?
See if they are saying.
If you can't hear me, we are also recording this on Facebook live, and then we will repost it. We will repost it on Instagram as well, so that if you missed anything, you can hear it. Okay, I'm getting mixed. Some people are hearing me and some people are not hearing me. So I'm not sure what to do with that, but I'll keep going. I'm hoping that Facebook, you guys can hear me. Okay, great. So Facebook can hear me. So that means that we can at least get this recorded and posted on Instagram if we need to. Yeah, they're basically audio on Instagram. So, Dr. Marian, you might be the one that needs to be talking a little bit more about some of it.
Oh boy. We can't hear you. Maybe unplug the microphone and plug it back in, because I think it was working at the beginning.
How's that, guys? Is that working now? Yes? Can you hear me?
I don't know. I'm asking them. Anybody? Kai, can you tell us if they can hear Dr. T?
Hello, Earth calling from Holistic. Okay, I'm hoping that we can hear us. So then there's hormones, right? The hormone balance is a big issue with depression. And there's twice as many depressive episodes happening in women, or women have the higher risk, twice as much higher risk to have depression than men do. And I think part of that is because we are dealing with estrogen. Okay, so as we're talking about depression and anxiety and some of the root causes, we're talking about estrogen. And estrogen, like I was saying, women have twice as much the risk of getting depression than men do. And I think estrogen and progesterone are big players in that. In fact, women have twice as much the risk of getting depression than men do. And I think estrogen and progesterone are big players in that. In fact, I'm now seeing more men become more depressed and I think it's because with men having more depression is partially because of not only the toxicity that we're exposed to in our food and environment, but also the estrogen levels are rising in men. So men are losing their testosterone and getting elevated estrogen, and I believe that is part of the reason why we're also seeing a rise in depression and anxiety with our man. So addressing the hormones is very important. We've spent a few sessions, Instagram Lives and Facebook Lives on hormones. Again, if you missed any, please go back to drdarvish.com, and you should be able to find those either on the media or under the blog section. So estrogens and hormones, xenoestrogens, we've mentioned before as well, which are things like plastic, that chemicals that basically act like estrogen in the body. And those can cause mood issues as well, and depression and anxiety as well. It is a very common problem to have around perimenopause and menopause, is going back and forth between this depression and anxiety and not knowing really what to do about it. And most of the time it has to do with the way we are metabolizing these estrogens, with the way our liver is working. So a lot of stuff goes back to the liver and the gut, guys. Liver and the gut. So if you're taxing your liver with toxins, chemicals, metals, medications, alcohol, wine, emotional anger, we are taxing that liver, and we are promoting long-term anxiety and depression. So please have somebody look at you. As we've said before, these episodes, these Q&A lives are really meant as informational purposes, and they're not meant to diagnose or treat anybody. And please do seek out a professional to look at you from a holistic perspective. You're obviously welcome to come in here at holistichealth.com to have a comprehensive evaluation of your hormones, the metals, the toxins, even spine, right? We forget that the spine plays a big role. When your spine is out of alignment, you're not getting the signals through the nerves into the tissues, to your thyroid, to your pancreas, to your digestion, to your liver, to do what they need to do. And so a lot of people can see or experience mood swings. That brings me, actually, we didn't talk about the hormones like thyroid and
Yep.
diabetes. So maybe you can enlighten us on that, Doc.
Yeah, so I was actually just going to jump in there and say that thyroid is a really important hormone producing gland when we talk about mental health, because hypothyroidism can contribute to depression. And for example, sometimes the standard reference range, or always the standard reference range, is 0.5 to 4.5. And so in conventional medicine, they consider that to be normal thyroid function. Whereas naturopathically, we really want to see TSH between 1 and 2. So even though you were told that your thyroid labs are normal, you might actually come to a naturopathic doctor and they say, well, no, we can actually optimize this a little bit, because we find people feel actually best with a TSH between 1 and 2, and with the free T3 number at an upper to mid range, as well as T4. So we're a little bit more specific about where the thyroid should be at as far as the reference ranges. And that's going to also contribute to your metabolism, to your energy level. Hypothyroidism can even cause joint pain. And so that can then consequentially also contribute to depression. All of those things can. And then the other one that you mentioned, I think, was it insulin or cortisol?
Yeah, or diabetes.
Yeah, so absolutely. If somebody is metabolically dysregulated, they are going to not be able to manage their blood glucose as well, and that can lead to spikes and falling of cortisol, which can then lead to mood swings, as well as food cravings, and really big swings between energy and anger and emotionality. That's also going to be doing something called a pregnenolone steal, which basically drags the hormone precursor, which is pregnenolone, down into cortisol and keeps you from producing estrogen, progesterone, testosterone, and DHEA, all of which you need to feel balanced and happy. And so if everything's getting funneled down to cortisol, whether that's because of blood sugar swings and blood sugar dysregulation, or because of chronic stress, then you're going to have less of the sex hormones that generally people find feel good. And then estrogen also increases CRH, which is corticotropin releasing hormone, and diminishes the glucocorticoid negative feedback. So you might be really stressed, you have high cortisol, but you're going to keep producing cortisol if you have too much estrogen around. So there's a really interesting, estrogen is basically a stress hormone. So cortisol and estrogen play close relationship to each other.
And our community here in North America is mostly estrogen dominant because of various reasons: lifestyle, our food quality, our stress level, toxicities, and a bunch of other reasons. So it is another thing that we need to look at for depression and anxiety. A lot of females feel palpitations. Men will too. Palpitations or anxiety around their cycles, or around menopause or perimenopause or andropause when it comes to men. And again, that is usually because you've got too much estrogen and not enough progesterone. One other note I want to make is that the metals we were talking about often sit in glands like the thyroid, like your adrenals, like your ovaries, like your pancreas. And so they can cause a dysfunction with thyroid and pancreas, diabetes, blood sugar dysregulation, cortisol, and ovaries and hormones, because of the toxicity that they impose and on the body, on the cells in those organs. And so you're not getting the proper release of hormones. They also will sit in the brain, right? So we look at the metals as one of the major causes of some of these hormone dysregulations. There's a question about, do the hormones cause the hair loss when stressed? Yes, hormones can cause hair loss, and that could be because of the progesterone deficiency, or too much cortisol, or not enough DHEA, or a variety, or too much testosterone, a variety of different hormone imbalances. So it is, again, an important one to look at.
So I just want to mention, because we're in the situation that we're in the world, a lot of people have lost their job, or, like you mentioned earlier, not able to connect with their family in the same way that they have previously. I know I haven't seen my parents nearly as much as I have pre-COVID times. And so you might have been feeling like a happy, healthy person, and then suddenly this pandemic came around and you are experiencing either symptoms of anxiety or depression. And I want to just reiterate that that's not always a sign that there's something wrong with you or that you have maladaptive stress skills or anything like that. Sometimes there might just be a vitamin D deficiency or thyroid is a little bit off, and it took this stressor to kind of make that evident. And so it's really important to get some of the physiological things checked out while also dealing with some of the emotional stressors through counseling or whatever works for you. So I just wanted to mention that. With that, and B12, absolutely.
B12 and B6 oftentimes are depressed. Sometimes it's magnesium that is also depressed in the system, as well as zinc and manganese. And so addressing some of those nutritional deficiencies can help quite a bit with the anxiety and the depression. So we've talked about a lot of different physical root causes. The other couple that I wanted to just mention briefly is concussions. If you've had a history of concussions,
read my mind.
Yes, if you've had a history of concussions, and I don't care if it was 20 years ago, 15 years ago, 2 days ago, concussion can mean just the head getting hit over few, hitting the ball and stalker a few times. It doesn't necessarily mean a big bang and you lost consciousness. It can be just repetitive injury to the head that causes a mild edema, mild swelling in the brain, and that can lead to depression and anxiety. And this is really important for us to discuss and to be aware of and to have addressed. Now, we have a question about finding community and saying prayers, and that is really, I was going to come to that when we get to the emotional stuff and the spiritual stuff, because like we said, I look at reasons for depression and anxiety in 4 basic categories: physical, mental, emotional, and spiritual, or all of the above, or some of the above. And so we've spent a lot of time talking about the physical, but we also need to talk about the emotional and the spiritual. And thank you, Afisa, for bringing that up, because our physical is interrelated with our emotions and our spirits. And joy gives me wings, and I know joy will give every single one of us wings to fly. And we need to keep looking at things from a positive perspective, no matter how dim the external environment may be. You need to shut off the media, stop listening to the news, stop looking at the social media sometimes with all the negativity, because all that's doing is making you more, or me as well, more negative and more scared and more depressed. We need to cut that out. Get out in nature. Get out in nature. Go hiking, go walking, go cycling, do something out there. Go do some acts of service. Go take some food for the homeless shelter. Go do something that will make you happy. Go plant some trees. It doesn't really matter what you're doing, but with the intention is much more important, right? Having the intention of creating a positive energy in this world will bring you joy. And that is what will pull us out of some of this depression for some of us.
Yeah, I think the Instagram is frozen again.
Prayer. I can't hear you again. Did I shut off again?
Yeah, I think Instagram froze.
Did I shut off on Instagram again?
Yeah.
I probably did, because I have connection issues with Instagram right now. So we're almost done anyways, and can I hear you?
There we are. I think it loaded.
Okay, I'm sorry. It keeps shutting out. So I was talking about how important it is to get out there into nature and be joyful, do some acts of service, something that will bring you joy. Focus and giving to others. The research has found the more we give, the more we serve, the more we love others, the more that kind of comes back to us, right? It's like a boomerang. You throw that out and it'll come back to you. And most important, I believe that relationship with the higher spiritual powers is of vital importance for all of us. And there's certain prayers that I say that maybe I'll share with you at some point. I know that they can't hear me again on Instagram, but again, we're running out of time, so we'll just post the Facebook one on Instagram Live. But the prayers are really, really important. There's a prayer that I say, it says, refresh and gladden my spirit, purify my heart. And those are the first couple of sentences. And just saying those sentences, those first few sentences, refresh and gladden my spirit, purify my heart, illumine my powers. I lay all my affairs in thy hand. Just saying those few words elevates me, and I think it elevates a lot of people. And there's a special power in saying prayers. It has a power to lift us from this physical world that we feel so burdened by. And so it feels so heavy that when we lift ourselves to higher realms, to higher levels of energy, that we are able to pull ourselves out of depression and anxiety. So maybe Dr. Marian, you can say some of that, repeat some of that for the Instagram people.
Oh boy. I don't know that I have those prayers memorized, but what Dr. Darvish was saying was that it's important to keep your vibrations high. I think in like maybe a younger person language, it's like keep your vibe high. Essentially just keeping a really positive attitude despite what's going on around you. And that might sound inauthentic or fake at times, but sometimes you do have to kind of fake it till you make it. Dr. Darvish recited some or prayers that really resonate with her, but I think that finding what resonates with you is important, and whether that's a prayer or a poem or a book or something that really keeps your vibration, keeps your energy level high, is really important for your mental health and also for the health of the people around you, because what you emanate, what you give out is what they are going to be experiencing as well. And so I think that's potentially a summary of what you said, but those prayers are beautiful.
I think, I think this topic of depression and anxiety is such a big topic that we've really homed in on the physical elements and some spiritual, but we really need to look at the mental and emotional, and perhaps
Absolutely.
We should do a second component of this next week on Instagram and Facebook Live, and discuss those other aspects, because it is so important, and we are so much into a very stressful time that I believe people need some new information to transform their lives and to help them elevate from this situation that we find the world in. And I think the biggest thing is to keep hope, right? Mm-hmm. So let's discuss this, Dr. Marian, next week when my Instagram is working better as well. And I have more connection. Perhaps I've lost connection somewhere and I've got to reboot. But I thank everybody for joining us, and we will see you next week. Please, if you do, or if you are experiencing some mood issues, please do consult one of us here at Holistic for a comprehensive evaluation, and or go see one of your healthcare providers to look at you from a much deeper angle than just sending you pills that may long-term cause more problems. So this video and this Instagram and Facebook Live has been mainly for informational purposes, and we will talk about this more next week. Thank you so much. Dr. Marian, if you want to repeat that for Instagram people, I will be happy. Thank you.
Yeah, so we're going to be discussing more of the mental and emotional aspects of depression and anxiety next week. Today we talked a lot about the physical and spiritual aspects, and the mental and emotional aspects are really important as well, especially given the current times. Hopefully we're going to have the Instagram up and working, and Dr. Darvish can be heard. And what else did you say, Dr. G?
So we will see you next week.
All right, we will see you all next week, and we are grateful that you joined us today. Please do seek care if you are experiencing depression and or anxiety with either one of the physicians here or your physician or any physician, because it's a really important thing to be managed. We wish you well.
Thank you. Namaste.
All right. Bye.